Hello everyone, so I am here today with Yixiu Zheng, and Yixiu has a wonderful medical practice called Renaissance Medical, actually right down the street from me. So I'd like to introduce you all to her, and thank you for, of course, joining us today and being willing to talk a little bit about your practice also.
I'm so happy and excited that you're here.
Yeah, absolutely. So just a little history also. Ishu and I have known each other for quite a while prior to her starting this practice as well, and I'll share a little bit, kind of, I'll interject here or there, but I'm also a patient, so if anyone has questions, so start us off by telling us, what originally made you, think of the idea of Renaissance Medical, a little bit about your background. I know you're an internist as well, and what made Renaissance Medical come to birth, come alive.
Yes, so I was trained as an internal medicine doctor, and I did my residency at Beth Israel.
Okay.
So it was all in New York City, and I treated many patients, and a lot of patients. They went on medication, they got diabetes, and they would always think that it was genetic, and there was nothing they could do about. And so slowly over time, I realized that a lot of these diseases could be prevented, and there are a lot of other things that we could do other than medication, like lifestyle changes, and that became a main proponent of Renaissance Medical, that we want to prevent the diseases from settling in. So we want to give the nutrients that's lost and give the hormones, and when your body has all the proper environment to thrive, and then you will delay the onset of diseases.
Absolutely. I mean, that makes a lot of sense to me in terms of just basically you're trying to make sure your body is in a happy place, for lack of a more technical way.
Yeah, optimal state.
Place.
Optimal state.
So that way it's able to function, and it's at the best of its ability. So, and I'll throw in there that, a lot of you know I have twins. Many of you saw me go way over 100 pounds when I was pregnant with the kids and everything. And hopefully some of you have also noticed that I've also gotten back to what I feel like is a more normal size for me, and kind of look like myself again. And and a lot of this had to do with some of the procedures, or some of the services that you offer here too, because I personally had concerns about diabetes. I had concerns about just kind of like the impact of joints and things like that. With all of this extra weight, my body couldn't handle it, so I knew I needed a change. But I will tell you guys that when I came to see Yixiu, I was stuck, and I could not figure out how to make any more changes on my own too. So I know with Renaissance Medical, even from my personal experience, you talked about weight loss. That's definitely one of the big pieces of your equation. You talked about hormone therapy, which I'll let you guys know too. That was something else that I had to jump on board with. What other services do you offer here that you think would be maybe beneficial for people to be aware of?
So I'm basically a whole body, whole person approach, and I believe the skin is very important on the outside, but even the way you look, and the way you look in terms of your age, actually it is how old you are inside.
Oh, interesting.
So if your skin, and you have a lot of dead cells on your skin and a lot of sun damages, it actually can signal inflammation markers to your body in the inside as well. I actually do a lot of skin treatments, and this is not just for vanity. There's a part of this is like less spa, sort of vanity, but it's also for health, skin health. It can improve the skin in the body inside as well.
So it's almost like it's if you have dead skin cells, it's like I would imagine you're being blocked from being able to breathe properly then, right? In a sense?
In a sense, right. Yeah. So if your skin is really, really damaged and you haven't been taking care of it for a while, they are called senescent cells or zombie cells, and they can actually secrete inflammation markers and signal other cells in your body to shut down as well.
Okay.
Yeah. So very interesting. I had a patient that came in. She was like only 50 years old, and she came in for a vaccine. But when I saw her, she looked like 75 to me. And I said something is off. So I told her, you gotta go get your mammogram. You gotta go get your colonoscopy. So she found to have 3 cancers.
Wow.
It was amazing. Yeah.
Wow. Yeah. And she hadn't gone probably for one of those checks in a very long time.
Exactly.
Yeah.
So over the years, this is what I saw, and I truly believe in pre-rejuvenation, in preventing illnesses, and this is what excites me.
Yeah.
You know, I feel like I give the most impact to patients'
We're trying
lives.
to be proactive about it versus, I think, at least what I've seen just from a very, layman standpoint within the medical industry sometimes is that very reactive response to, okay, there's a problem, now we have to put you on medicine. But if you get in front of it, then hopefully, like you said, you're able to eliminate some of these things. And even with stuff like type 2 diabetes, because I know we were talking about that, I mean, that's not necessarily genetic. That's where, with proper care of yourself and your body, you can potentially avoid or even reverse that.
That's right. Yeah. Many patients, they come and they thought, this is it, this is their lifetime sentence. And I would tell them, if we do this quick, we could reverse this. And I've had many patients that I was able to put them back to non-diabetic state.
Yeah. No, I mean, that's huge because, and I'm just thinking even from like, a thyroid standpoint, things like that too, being able to try to figure out how to kind of reboot your metabolism. All of those things tie in, but the skin aspect, I'm gonna have to remember that. I'm gonna use that with Jimmy, because if I keep my skin good and everything is like clean and clear, and I don't get any of those inflammation markers, then being proactive, that will hopefully help eliminate things from the future. So this is part of my my personal pitch that I'm gonna create for my husband when he complains about extra stuff I'm doing. So
sunscreen,
sunscreen,
prevent sun damage.
Yeah, especially when you're like so pale, it's rough. And now I know you also do, like, if you have kind of problematic spots and everything, you've done fat injections, like Kybella, and
lipolysis. You can do the rest of the body as well. And basically kills the fat cells.
Okay. Which for many of us too, especially if you went from like one weight to another weight, and I know I have a lot of mom friends out there and a lot of twin mom friends out there. It can sometimes be hard to like lose all the weight perfectly evenly. So sometimes just being able to get a little help with those problem areas, frankly, from a mental health standpoint, I think makes a huge difference too. So
it's helpful. And also the skin laxity, I have the microneedling and the PDO threads that could tighten up the skin as well.
Okay. So if you remove the fat, then sometimes if you have that extra skin, you need to go back in and kind of do a little something to make everything seamless.
Yeah. I had a patient who lost like 100 pounds and his skin was quite loose. But now if he wasn't interested in some of the lasers or some of the PDOs, and he did the growth hormone peptides, the CJC, epimoreline, the growth hormone peptides, which is great for skin laxity.
Oh, interesting. So that helps to tighten. Is that an injection or is
it
pills?
It's an injection. It's an injection.
But it helps to kind of like rejuvenate. What does it take you back to, like your younger days in terms of what your hormones were?
Right. Something like that. So now those are called peptides, and they are not FDA approved.
Okay.
So kind of experimental but very safe.
Okay.
I myself is on it, and the sleep is great.
Which is also something that I know we've talked about. Like I have had challenges with sleep and kind of all of those factors, and I will say, just for me, the low dose of testosterone even has been night and day. So I mean, it put me to kind of that more like even level where I can go to sleep without needing, you know, maybe medicine or some of the same like supports that I felt like I needed before, and that was just, it was a hormonal correction for me after the kids. So
so many of us, so many of my patients come in with sleep problems. A lot of times they will say sometimes they feel like they haven't slept 1 second when they're on their bed. And a lot of it have to do with stress. And when your stress is high, your hormones are low. And when you put in that hormone pellet, you actually will produce about 20% of growth hormones. So you imagine when you were a kid, your sleep is so deep. Like you could make so much noise and it won't wake up. You know, that's the growth hormone. The growth hormone makes the sleep, the deep part of the sleep, and when you grow older you lose that growth hormone, so that the sleep is not as deep anymore.
Oh, all right. I didn't realize like
there's a connection.
Very interesting. So, and I know also, like you mentioned earlier about I think you were touching a little on like the IVs and kind of those types of treatments, like all of that stuff can also tie in, like magnesium, like glutathione, all of these things. And for those of you, I know the IV infusions have gotten like way more, you know, popular over the last, I don't know, maybe 5 years or so even. But that's something that Yixiu's able to help you with as well, or I should say Dr. Zheng is able to help you with as well and the glutathione is really, that's an antioxidant, right?
So glutathione can help you detox as well. So we all know, you know, we are surrounded by toxins, unfortunately, you know,
especially in New York,
fish, mercury in fish, you know, and BPA from the plastics, you know, they actually stay in your fat, and sometimes if they stay in the fat, and you may have problem losing weight. So that may be another piece of the puzzle as well. So when we do detox, the weight may come off easier as well.
So another reason to lose the weight too, because you're literally like holding toxins.
That's right. And those toxins actually will destroy your stem cells, damage your stem cells. When you want those stem cells to rejuvenate your body, renew your body.
So basically, like what I'm hearing is that like even you can eat as many berries and everything as you want, but also sometimes you just need, at least for me, like you just need that, like the glutathione to go straight to where it needs to go, so you're not having to worry about kind of that additional processing too.
It's always
more effective.
Right. It's helpful. But there are things that you could do at your own home, and it's totally free, like intermittent fasting. So if you do 16 hours of intermittent fasting 2 times out of the week, so you will finish your dinner at 6, and then you eat again around 10 a.m. for breakfast. It's probably like 16 hours. So studies have shown that when you do 16 hours of fasting, your own body is going to eat up the bad cells, and then you produce more stem cells.
And only 2 times a week is enough to make an impact with that. Okay. All right. That actually doesn't sound too bad to me. That's a pretty easy thing to do, to try to like give yourself almost like a reboot. So
Exactly.
So from, what do we say, from 10 p.m. or no, from 8 p.m. to like 10 a.m. or
6 p.m. 6 p.m. till 10 a.m. So no food. 6 p.m. to 10 a.m. and then you can only eat 10 a.m. till 6 p.m. basically.
Gotcha. So that 16-hour window, whatever it is that means for you, to try to give yourself kind of like that extra boost to get that, you know, summer body that everyone's going to start thinking about.
I'm excited for the summer. It's summer already.
Absolutely. I know. It's gotten, I think all of us have had to put our ACs on recently, so it's definitely gotten more. Now, a couple other questions. So for anyone who has, you know, additional questions, wants to obviously do like, you know, a weight loss consultation, discuss all of this in further detail, we're going to put Dr. Zheng's information, you know, available so you can reach out to her directly. I have a couple fun questions I wanted to ask you just to be able to close this out, because I know you have people coming in. What would you say is probably the best part of your job and the worst part of your job? And I think we kind of touched on it a little bit as well.
Yeah. Well, the best part is to see my patients thrive.
Yeah.
They tell me these success stories. They have so much more energy now. You know, play with their kids. You know, build their new career. You know, those it's just like life changing.
And it's the
for
whole,
them.
It's the whole body, whole person approach. I think that's what's really like.
And it's happy. And it's happy. And it's very optimistic.
Yeah.
Yeah.
Absolutely.
The worst part is probably seeing some. I have had some really young patients that got diagnosed with something that's totally rare, and they just see them deteriorate, and they haven't had a chance to, you know, live their life, and it's just very sad.
Yeah. Absolutely. I mean, I think that has to be, no matter what type of medicine you practice, that has to be the hardest thing to deal with. And I think that's also a reminder to all of us that, you know, as much as we complain, or I'm going to say I complain, like at the end of the day, I mean, really, if you have your health, you have everything. Yeah. Because it gives you the ability to do, and, you know, anything you want, to spend time with your family.
That's right.
I mean, that's the most critical piece out of what we do. You can always make more money. You can always go into another career. You can always, but you can't necessarily, you know, get your health back when you've gone to this, this far extent. So, and then last question, that's always my favorite. What would you say is your favorite part in all of New York City?
The south side of Central Park.
Okay.
I mean, I've been living in the Upper East Side for like 15 years now. Okay. And I love to go to that side of the park where there's a pond where all the ducks are. You're not supposed to feed the duck, but I feed the duck with whole wheat bread, and they love it. And it's very exciting, and my daughter's there too. Sometimes we bike around there, and you can see the skyscraper on the south side of Park Avenue. Yeah. And we've taken the carriage with the horse around the park, and that's so romantic.
Maya loves that too.
Yeah, so romantic. Yeah. And then in Central Park Zoo, there's actually a tropical zone. Even in the dead of winter, you actually go in there, you feel like you are in Southeast Asia. And there's like lemurs, all these birds, and it's beautiful. I'm
gonna have to check that out. Yeah. Before we jumped on, like, we were chatting about that, and of course, many of you know I live in Lenox Hill. Dr. Zheng is in Lenox Hill. She's literally on 63rd Street, where you will often see listings of ours pop up. And we have a membership to the zoo. We've had this membership forever. And I don't think I've actually ever gone into that particular portion. Yeah. But it sounds like kind of an opportunity, even if you're not with your kids, to be able to just like take a minute, which I know I can use most of the time. So very nice. Well, thank you for joining us again today. And I think there was a lot of really great information that you shared. So
thank you for having me.
Yeah, absolutely. So again, for any of you who have questions, feel free to also reach out to me if you want to kind of pick my brain about, you know, personally what I've done, some of my experiences. I'm happy to share. I'm an open book. But if you want to talk to Dr. Zheng, of course, you know, directly, privately about, you know, what you're thinking, what you feel like you might need some support with, just remember her approach is a whole body, whole person approach. She has it's not just a med spa, she has a background in being an internist as well, so she truly understands kind of what's going on aside from just like, you know, facial laser treatments. That's the fun or easier stuff. So thank you for joining us, everyone, and we'll see you soon. All right, bye.
You can always come in for a free consultation.
Oh, absolutely. All right, so that's a good one. I almost missed that. So free consultation, you can't go wrong with that, and it at least gives you something to kind of to think about in terms of, you know, what steps you want to take, or kind of creating a plan, like a personal plan.
That's right.
So awesome. All right, take care.